In this video, I'm going to talk about 5 reasons you should avoid learning scripts to get you through your PLAB 2 exam. I'm Dr. Aman Arora from Arora Medical Education. I've been lucky to train thousands of doctors through their PLAB 2 exam preparation. We're literally just by the office at the moment, a beautiful coffee shop, as you can see. I'm just basically, it's a stunning day, and I thought I'd do this really quick video because we help a lot of PLAB 2 doctors pass their exams through things like our mock exams and live courses and online courses and audiobook courses, and some of the things that we teach on those are things that go against the grain. So I see a lot of doctors basically learn pages and pages and pages and reams and reams and reams of scripts thinking that's going to get them through the PLAB 2 exam. Now PLAB 2 has changed a lot. In the older exam, I would say scripts had its place because they were much shorter scenarios. It was very task-based. Whereas now with the 8-minute scenarios, with the fact that you need to demonstrate skills across 3 branches, data gathering, interpersonal, and management, scripts sadly are not the way to go. And I see people investing a lot of time learning these scripts and getting into trouble. So we're going to talk about 5 reasons why I would avoid this type of preparation. If you're new to the channel here, please do subscribe. We do lots of videos around PLAB 2, and I really hope this video is going to be of some value. Let's get going. So reason number 1 to avoid a scripted approach is that you miss cues. It's inevitable that if you're focusing on a script that you think is going A, B, C, D, E, when you see cues or where you hear cues, you are going to miss them because your brain is not looking at the big picture. It's focusing on what's coming next. A patient says something, you miss it. A patient does something, gives you an expression, holds their shoulder, some kind of thing that is supposed to get your attention, that is giving you an opportunity to pick up on something and move it into a consultation. We miss them because we're not paying attention to what's going on around us. We're paying attention to what is coming next. So one of the commonest things that I see when people prepare for PLAB 2 in our mocks and our role plays is the missing of cues. And it's not that we often miss cues because we're not very good at picking up cues. It's that we're missing cues because we're so focused on a scripted approach. We're thinking, well, they've said this, so therefore the next thing will be this, therefore the next thing will be this. This doesn't work. When you start missing cues, you miss connections, you miss opportunities to find out more issues that can help you manage things on a bigger scale in terms of the management plans. So try and avoid a scripted performance means you're going to pick up more cues, both verbally and non-verbally, and hopefully, therefore, you can bring those things back later in the consultation to help you score marks. We've got other videos on how to deal with cues on the channel, so check those out. But number 1 reason, avoid scripts because of missing cues. The second reason that I would avoid using a scripted approach is that, as I mentioned earlier, you only see the small picture. You avoid seeing the bigger picture. What do I mean by bigger picture? In PLAB 2, you are supposed to be assessing a situation, right? You're supposed to be understanding and gathering data by asking questions about a situation as a whole. And then in the second half, you need to be demonstrating that I'm managing the situation as a whole. Now, if you've got a script in front of you, say for example, a hypertension case, and you've read a hypertension script, you're going to do a really decent hypertension history because you've learned the script about what to do when someone comes in with hypertension. So you're going to go through all of those questions and get a pretty decent workup about the clinical side of hypertension. When it comes to management, you will manage hypertension as per the guidelines. You've read the script, you know what to say, you know the treatments, you know the lifestyle advice that you're going to give, but you're sticking to a small picture. This is a hypertension case, this is what I've learned about it, now let me repeat it in terms of an exam. When you are following a script, you are going to miss the bigger picture. Because you're thinking on a one-track mind, you don't ask more open, rounded questions that often gives you more information to allow you to see the management plan as a whole. We talk a lot about holistic management. You hear buzzwords about holistic management and patient-centered care. You can't give patient-centered care and you can't do a holistic management if you're seeing the small picture, i.e. this is a hypertension case, this is what my script says about a hypertension case. So it's really important to try and stay away from scripts from that point of view alone, and that if you stick with scripts, you will see a single narrow tunnel vision and you'll be missing a lot of the peripheries, and it's the peripheries that get you the higher scores when it comes to a PLAB 2 scenario. Remember, everyone is going to ask about hypertension properly and everyone is going to manage hypertension properly. It's those that have seen the bigger picture and worked out more things about that situation, those are the people that are going to usually score higher in their PLAB 2 case. So second reason to avoid a scripted approach is that it causes you to see a small picture and you want to be seeing a much bigger picture. Reason number 3 for avoiding a scripted approach, this is a big one and often is talked about a lot. people are very doctor-centered when they focus on a script. Imagine this, you're trying to see a patient, converse with the patient's sitting in front of you, having a conversation. If my mind is constantly thinking, what's next on the script? What's the next question I need to ask? What's the answer they're likely going to give me? What comes next? What bit of examination comes next? If I'm focusing on that, then I'm in my own brain. I'm being very doctor-centered. What is the meaning of doctor-centered? It means basically I control that whole case, I rule the case, it's all about where I want to go, what I want to do, which path I want to see. Similarly in the second half, I'm thinking about a script, that this is a knee osteoarthritis, knee OA case, and it's a pain management case. I've got my script in terms of escalating knee arthritis pain, what am I supposed to say, step 1, step 2, step 3, etc. If I'm focusing on what I need to say alone, then it's going to be doctor-centered. Even though the way that I say it might be patient-centered, the fact that I am calling the shots, I am going from one step to the next, means that automatically I'm ignoring the person in front of me. I'm ignoring their input, and therefore it's going to look and appear and sound doctor-centered. So the third really important reason, and people ask me a lot about how to be more patient-centered, one of the first things I say is, look, drop the script. Because if you drop the script, you're more of yourself. If you're more of yourself, you're bound to pay attention to the patient. If you pay attention to the patient, it'll help you be more patient-centered. So we've covered 3, we've got 2 more to go before we move on to numbers 4 and 5. A reminder to please subscribe to the channel if you haven't already. If you're preparing for PLAB 2, we have so many more videos on communication skills, concentration skills, and just how to prepare for PLAB 2 in general. So please do share, like, and comment. It really helps us grow the channel so we can create more content for you. Let's move on to numbers 4 and 5. The fourth really important reason to avoid a scripted approach, and I think this is a super important one, is that when it goes off script, it causes immense panic. And I've seen doctors preparing for PLAB 2 and doing role plays and mocks and courses for a long time, and you always see that same look that, gosh, okay, whoa, I wasn't expecting that, or that wasn't what I've prepared for, or gosh, that seems out of the blue. And that frozen kind of 1 or 2 second appearance that you get of somebody when you have to suddenly deviate from the script, the panic it causes impacts the rest of that case, because you've lost that rapport with the patient. The patient thinks that that's a bit odd. The assessor's listening and realizing that actually you're not quite sure what you need to do now. That impacts everything from data gathering through to interpersonal through to management. So scripts, okay, they might go to plan, they might be seeming to go perfectly well. Yes, you're probably missing cues, yes, you're probably being a doctor-centered, but at least it's going to plan. But the moment it veers off path, it causes a lot of internal problem, the confidence in the case goes, and you end up mumbling your way through the rest of the case and then thinking, oh, why didn't it follow what it was supposed to follow? This is 2 human beings talking to another over an 8-minute period. It is not going to follow the path that you expect it to. The inevitability is it's going to go off a path that you think it should be going on, and that will cause you a lot of panic and overall, therefore, much more harm than good. And the 5th reason, and a really sad thing that actually happens when people start to use a scripted approach, is that it can lead to complacency, let's be honest. Like, people kind of think, look, if I just learn, these 1,000 pages of scripts, I'll be fine, I'll pass PLAB 2. Everyone tells me just learn the scripts, if you do that, you'll pass PLAB 2. So it leads to complacency in preparation. Firstly, your role plays become weak because you're just following a script, you're not thinking about what you're doing, you're just following a script. Complacency, but also, and secondly, it causes complacency in the exam as well. If you're doing a case, for example, in the exam, you think this is going perfectly to plan, I've practiced this case, I know where I'm going, you start to shut off, you start to not ask those open questions, you start to not manage the situation because you're complacent, because you think you've got this case right, and therefore you, like we said at the beginning of this video, you miss the cues, you don't think about a holistic approach, and you end up scoring less than you could have if you hadn't followed that script. So complacency, sad to say, is a real thing in PLAB 2, both in the preparation approach when people get into their comfort zone, and both in the exam as well when they're complacent about a particular case. And this is why when we do our teaching and our role plays and our mocks, we push you out of that complacency zone, because in the exam things are going to hit you that you're not expecting, and we try and put you in that position beforehand so that you get out of that complacency feeling and actually focus on what's going on in front of you. So guys, to quickly recap then, 5 super important reasons why you should not follow a scripted approach when it comes to PLAB 2. Number 1, you are going to miss cues. There is no doubt about that. Number 2, you're going to see the small picture and miss the big picture. Number 3, you're going to be doctor-centered even though you're trying to be patient-centered. Number 4, it is going to cause panic when it goes off script. And number 5, it leads to complacency. Now guys, I want to try and help you in your preparation, so please don't forget to use the coupon Arora Video 10, ARORAVIDEO10 for 10% off any of our PLAB 2 resources, whether it's our PLAB 2 mocks, online courses, live courses, audiobooks, whatever it might be. Don't miss out on that discount, and please do watch some more of these videos on the channel because they're all related to PLAB 2. They're all going to help you boost your score. Small changes make big differences when it comes to PLAB 2, and I really want to help you boost your score and reach your potential when it comes to the PLAB 2 exam. I'm Dr. Aman Arora. I'm a previous PLAB 2 examiner, so I see this stuff all the time. But one of the commonest things that I spend my time telling people is do not have a scripted approach, and these 5 things will not be a problem to you. Listen guys, I hope you had a super day ahead. I hope your preparation is going well. If you're preparing for the exam, like I said, we're in a really nice coffee shop at the moment. I thought I'd do a really quick video. It's a beautiful day. Hashtag Campus will pass. Hashtag I went with Arora. Have a super day.